everyone. Hello, everyone. My name is Swetha, and I'm reporting from ACR 2021 for Room Now. And I'm joined by Dr. Jean Liew, a rheumatologist at Boston, to talk about her study, Hypertension and Ankylosing Spondylitis, the data from the SOAS cohort. And this is to be presented on Sunday, November 7th, in the poster session number 0910. Thank you so much for joining us, Dr. Liew.
Thanks for having me.
I can start off by asking you, could you please elaborate on why you embarked on this study?
So we know that there is this cardiovascular burden in people with spondyloarthritis, including ankylosing spondylitis. And we know that it's greater compared to people in the general population who don't have AS. And we also know that hypertension is pretty prevalent, pretty common in people with AS. So there have been kind of conflicting studies looking at TNF inhibitor initiation and whether that lowers or raises blood pressure in people with rheumatic disease, including AS, in small studies only, or in slightly larger observational studies, whether that effect is seen in people with RA. So because it's unclear, and also because the first line therapy for AS, which are NSAIDs, are definitely associated with higher blood pressure and hypertension in the general population and in AS as well, we wanted to know if TNF inhibitor use was associated with incident hypertension.
Thank you. And could you please tell us what you expected and what your results really showed?
So I think we could have expected it to go either way, but I would have expected that if there was any result at all, that TNF inhibitors would actually be associated with lower incident hypertension risk in AS, because we also think that with systemic inflammation from active disease or uncontrolled disease, that actually increases your cardiovascular risk and could also increase your blood pressure, which is sort of a surrogate to a hard cardiovascular outcome like an MI or a stroke. So I would have thought if we saw any kind of significant association at all, that it would be a protective association. Actually, we were not able to show that there were that our data supported either an increased risk of hypertension or a decreased risk, because we just don't have the precision here to show that association. So all of our confidence intervals cross to null, and our point estimates are actually pretty close to 1. So perhaps there really is no association, but we also can't say that either.
Thank you. And again, like just continuing from that, what do you feel were the challenges that you faced that this wasn't possible to prove that there was a protective effect?
Well, it's an observational study, so you can't ever prove that there is a causal association. I did use causal inference methods, but when you use causal inference methods in observational data, you have to make a series of assumptions about the data and how they were measured and what the relationships between variables are. And if any of those assumptions that you make are not true, you can't really have this inference that that exposure X causes outcome Y. So it's really just it's a feature of the design, I would say. I think your question is also about like what are the difficulties about this. I think we're still at this question of if someone is at particularly higher cardiovascular risk and they're on NSAIDs, should you be more aggressive about transitioning them to a TNF inhibitor? Would that make things better? And I think we are still at that position where you have to really have an individualized discussion with your patient about their cardiovascular risk factors and about the knowns. And I think the known is that NSAIDs do increase blood pressure and may increase their cardiovascular outcome risk. So maybe transitioning them to a TNF inhibitor might be better in that situation, but can't really say for sure with these data.
Thank you. And so what I did notice that the majority of the population studied were Caucasian males. Do you think there would have been any difference if this was an African-American population, given that there is some data out there that they have a higher risk of being hypertensive?
So that's a really good question, and I could give a really nuanced answer there. So as you know, rheumatic diseases are understudied in non-white populations. And although our understanding of ankylosing spondylitis is that it's a predominantly white and male disease, perhaps this is an understanding based on selection bias in our studies or epidemiologic studies, and that we just have a lot of understudied populations still where this disease is not well characterized. So because of this paucity of data, I can't really make a guess on what this would show. I think if we had a larger Black population with AS that we could study in the same way, but observationally, I think we would possibly see an association, but then you would have to say, well, what are the unmeasured confounders in that observational study that gives us that association? Because do we actually think that it's something related to biologics and biologic effects, like genetic effects, or is it actually unmeasured confounding from social, economic things, structural things? So kind of a complicated answer to basically just describe a broad issue with understudied populations and a need to include more inclusive populations in our research studies so that we really are able to generalize.
Thank you. That was excellent. And my last one, what do you think future studies should be focusing on this topic?
I think if we had a larger observational study on this topic, we could try to get at this question again, but then with larger databases like administrative or claims data, you would lose the granularity of the data variables, which would then also affect and bias the results from an observational study. And this is not something that we would likely measure with a randomized controlled trial. So I think not sure that we would have a firmer answer here for this research question specifically.
Thank you. Thank you so much, Dr. Liew, for joining us. This was a fantastic discussion. Please remember to check out this very interesting poster and log into Room Now for more ACR coverage.